Good evening. We are here once again on a hot topic, and that's health and safety baseline for Asia. After many projects that I've participated in, I noticed that a few health and safety professionals actually do not know which information to pick and include in the health and safety baseline that will aid them in a risk assessment or risk evaluation. My name is Moses Okuni, and I'm a health and safety professional. Today we shall look at 1, introduction to health and safety baseline assessment, 2, air, water quality, noise and vibration metrics, transportation and road safety data collection, community fire and bush burning behaviors, health facilities and medical data, social health and safety factors, school and community facility assessment, and then hazard identification for flora and fauna. Let's dive right into introduction to health and safety baseline assessment. Before we continue, let's first look at the purpose and importance. Why should you establish a baseline? A baseline is supposed to be established so as to identify existing risks and site conditions before work begins to inform future planning. It also helps measure change over time. This is how does the project affect the community? How does it impact the baseline conditions? Is it positive? Is it making them worse or improving them? And then also now ensure compliance. See, if the baseline is not determined, then the organization cannot ensure compliance because you didn't know the condition of the site before, so you cannot implement effective mitigation measures. So that's why you have to know the baseline so that you implement effective mitigation measures. Also, a few health and safety professionals may not really understand what an environmental impact assessment is. So I just want to take this time to define the steps involved in the assessment. Starting with scoping and early engagement. So define project scope, key issues and stakeholders. Conduct baseline studies. Let's assess physical, biological, cultural, and socio-economic conditions, and then impact identification and mitigation, evaluate the risks, propose alternatives, and plan mitigation measures. And then 4, seek for the approval of the ESIA and receive the NEMA certificate, and then monitor the implementation of mitigation measures, and this is done through annual audits. So when you look at environmental impact assessment with reference to Uganda, what influences the extent of the ESIA assessment? 1, environmental diversity. Uganda's ecosystems range from rainforests and wetlands to savannas, supporting rich biodiversity and complex land use patterns. We don't want to affect animals, plants, destroy their habitats, also destroy the land tenure systems of the country. So we need to first assess and determine how the project is going to impact those resources. And then the socio-economic challenges of the country, rapid population growth, rural livelihoods, and informal settlements. And then development pressures, expansion in mining, agriculture, and infrastructure projects increases risks of pollution, resource depletion, and social displacement. The reason why an ESIA needs to be conducted so that all these impacts are captured, assessed, and then mitigation measures put in place. It's good for a project to bring about improvement, not degradation. So we are diving into air and water quality, noise, and vibration metrics. So measurement of air quality, vibration, and noise levels. So there are measurement tools. For health and safety professionals, you may not actually be the one conducting these measurements, but these measurements constitute your baseline for assessment of the risks. So air quality and decibel meters, those ones are used for measuring air quality and noise. And then the vibration analyzers. All this equipment are used to collect air quality, environmental noise, and vibration data. We have air quality and noise data. So how do you assess actually? How do you interpret this data? So there are a threshold defined by WHO and NEMA for the case of Uganda. So most of the values should be below the minimum thresholds. So if they are above, then the risks should be assessed further so that we understand if the project is going to worsen or improve. And then of course the vibration data, we know that structural safety of buildings is related to vibration. So if the vibrations are so intense, then structures that are very close to the project area will develop cracks and hence they will fail, which becomes a safety issue. So you need to know even the vibration data and understand that. And then water quality analysis procedures. So we also need to understand the water quality. You know, we have what we call sensitive receptors. So sensitive receptors, these are areas where we expect the project impacts to be the highest. Can be schools, can be water bodies, can be hospitals. So in these sensitive receptors, this is where all our measurements are conducted from. So when it comes to water quality analysis, all the swamps or water bodies around the project area have to be assessed. So the water samples are picked from these water bodies, submitted to the lab for assessment, and then the results are compared with the thresholds defined by NEMA or other international bodies. So if the values are higher than the thresholds, then maybe the water is already polluted. So we have to assess if the project is willing to implement mitigation measures that can improve the water quality and not make it worse. So that's the entire process. So the report, so all this data after getting the lab reports, it is transferred into the ESIA report as water quality baseline. So you'll have sections: air quality baseline, noise baseline, water quality baseline, and then the vibration baseline. So a health and safety professional is supposed to use this data later in the risk assessment. So transportation and road safety data. Here we need to understand the type of traffic in the project area, the states of the roads in the project area, the volume of traffic or the frequency of traffic on roads in the project area, And then we also need to know the accident hotspots called black spots. So these are areas where accidents happen frequently, so they need to be captured. So all this information will actually be included in the traffic management plan. So when you understand this, then you're going to properly conduct a risk assessment and develop a proper traffic management plan. You see? So this is the data you will need. So what do you assess? So assessment of road conditions. What is assessed is surface quality, drainage, signage, and pedestrian facilities. So via visual checks and technical surveys. So when you look at Uganda, the poor roads actually lead to increased accidents, and inaccessibility of the project area actually will raise the cost of the project. So understanding the state of these roads helps the project team either request the government to improve on the roads before the project, or actually help the organization allocate some money to improve on the condition of these roads. And then the road accident statistics, and then identification of black spots. So the first thing is we can first identify the type of traffic that are using these roads: buses, trucks, sedans, motorcycles, bicycles, and then tricycles, and then pedestrians. So this supports dedicated lanes, crosswalks, safer mixed traffic planning. And then you have to look at the accident frequency. This data, you get it from the traffic office, from different police outposts that are close to the project area. So this will help you actually understand the rate of the accidents and evaluate if the project is going to increase on this, and then determine the mitigation measures, which sometimes involve community sensitization, driver training, and then proper vehicle maintenance regimes. And then the black spot identification. These are areas that are prone to accidents, so they need to be identified and included in the traffic management plan, and also in the driver health and safety training, mostly when it comes to defensive driving. So these areas, they need to know them so that they are aware, so they are alert whenever they reach there. So this will actually reduce on the number of accidents in the community. So the road accident statistics also help determine the risk factors. So for example, poor signage, because most of this, you may find that there's some accident investigation reports that may have picked up the causal factors, and then some of them can be classified as risk factors, which are poor signage, hazardous road layouts, and inadequate enforcement contribute to elevated accidents. And then mitigation effectiveness. So understanding the accident frequencies in the area helps come up with the interventions, effective interventions. And then we'll move to community fire and bush burning behaviors. In Uganda, mostly during dry seasons, most communities actually use bush burning as a method for clearing farmland, some regenerating grass for pasture. So these behaviors actually, if a contractor has camps situated in areas where bush burning occurs, then the camps are prone to fires. So understanding this helps you come up with a risk management plan. How are you going to manage these bushfires so that they don't have an impact on the facilities of the contractor? So investigation of bush burning practices, they are cultural practices. Bush burning is widespread in Uganda, used for land clearing, pasture regeneration, and pest control. Practices vary by region and tradition, often timed to seasonal cycles. What are the associated risks? Uncontrolled fires destroy habitats, degrade soils, and threaten settlements and infrastructure. Dry season burns spread rapidly, increasing air pollution and health hazards. So now when you're assessing this, this is what you pick up and include in the ESIA report. It's this same information that later would be used to develop an ESMP, that's Environment and Social Management Plan, of which now in the language of health and safety profession is just an action plan. How do we mitigate these risks? So intervention needs surveys, track frequency, seasonality, motivations, and techniques to map risks. Insights inform community education, very important. Community sensitization, fire breaks, early warning, and sustainable land management alternatives. So sometimes for the camps, you may say the land outside the fence of the camp has to be cleared or has to be dug to ensure that even if there was a bushfire, it will not spread to the camp. So clearing the bush around the camp would be a mitigation measure, which actually works. Availability and effectiveness of fire and rescue services. As a health and safety, you also need to note this. You need to note this. For example, the staffing levels. Does the project area, can be a sub-county, can be a district, do they have enough qualified fire and rescue services personnel? If yes, then you can draft an MOU to ensure that they provide firefighting services. If no, what do you have to do? Are you going to boost their training, or are you going to train your own employees to manage fires? And then equipment availability. In Uganda right now, it's very difficult to even locate the fire and rescue stations. So meaning the facilities are quite limited. So contractors are forced to have their own systems in place. If a fire engine is expensive, then you're going to have to install hose rails, hydrants, you see, of which this will need continuous supply of water, and then install sprinklers in every room in the camp, such in case of a fire, and then the smoke detectors with a cause and effect that triggers the sprinklers to release water to fight a fire, you see. So all this can only be planned after you've assessed. So that's why it's really important. Response times, you also need to know how long it will take for the fire and rescue service to reach the campsite. If it is taking longer, then it's better for a contractor to put in place measures to protect themselves from fire, not necessarily depending on fire and rescue services, so they can have their own systems in place. And then, of course, it comes to training and readiness. It's from these assessments where you can come up with topics. When it comes to like maybe firefighting, you train employees on that, on firefighting, is because you picked it up in a risk assessment. And then how do you assess community fire risk? You know, this matrix, you look at high vulnerability and low readiness, and then high vulnerability and high readiness, and then low vulnerability and low readiness, and low vulnerability and high readiness. So when you have facilities in place, you have people trained, you know, you have good roads that improve on the response times, definitely you'll be, even if you're vulnerable, but the response time will be reduced. The facilities will be there to help fight a fire. So that's the matrix you'd use to assess that. And then health facilities and medical data. Understanding the closeness of health facilities to the site will actually enable the companies, contractors, to plan for accident emergencies or medical care for their employees. For example, if there is a health center 3, maybe with limited services, there's no emergency ward, it means the company need to improve on its clinic so that it will be able to provide the services that the health center 3 is not providing. Or if there are no ambulance services, you see, then the company can designate a vehicle and a driver to act as emergency responders to help provide ambulance services, take the affected employees to the nearby facility which has the emergency ward to handle such kind of accident. So let's dive into health facilities and medical data. So treatment volumes and disease trends. So health records highlight high patient volumes and prevalent conditions, especially malaria, respiratory infection, and diarrheal disease in Uganda. So that's an example. So when you know this, then you can come up with proper mitigation measures. For example, we know diarrhea is a problem. So we need, what we need in the camp, we need maybe pit latrines and provide hand washing facilities. Also provide this is soap for washing hands, water for washing hands. When you realize that there's malaria, so any stagnant water around the camp will be, drained. So most of the mitigation measures are actually derived from the information you get. And then also when it comes to planning for disease management, some of these diseases are communicable diseases. So disease management plans can only be developed, or even improving on the services of the company clinic to handle the most common diseases in the area. So you know that instead of the workers struggling, moving up and down looking for treatment from a nearby facility, the company should be able to provide such facilities. And then infrastructure availability. You also have to ensure that the ambulance fleets are available. If not, like I said before, the company has to improvise. And then operational challenges, fuel and everything. So you may find the nearby health centers or hospitals actually do not have operational budget. So they will need the affected person to provide possibly maybe fuel. So all this will be taken into consideration when the company establishing themselves to start the project. And then pre-hospital care and quality. So basic life support is not constantly available en route. So you may find you need to have those facilities in place. So improve on the services offered by the clinic. The nurses have to be trained to provide emergency care before the affected person is transferred to the hospital. Then improvement strategies, prioritize central dispatch, minimum equipment standards, untired crew training. Say invest in fleet maintenance for fuel reliability and road access, formalize referral pathways and performance metrics for continuous improvement. So all this can be done by resorting to MOUs. So meaning for services that cannot be provided by the company clinic, then you need to have an MOU with the facility, health facility that can provide those services. So all this information can be used in planning for emergencies and everything. So you need to pick it. Now we now have what we call the social health and safety factors. These stem from drug use, mob justice, sexual exploitment and harassment, defilement, assault. So all these aspects, social aspects, have to be looked into. So you need to get information on drug and alcohol use, so that when you assess, you know that most of the crime is due to drug and alcohol use. So knowing or getting information related to drug use and alcohol in a given community helps the company to develop drug and alcohol abuse policy to help manage this in the organization level. See, so getting information on assault, defilement, and domestic abuse also is important, so that the company can develop measures to support workers who may be affected by this, and also to protect the workers. For example, if an employee is attacked by a mob, there must be a way of ensuring that these employees are protected. And then we have school and community facility assessment. Like we said before, we need to locate the sensitive receptors. So sensitive receptors can be schools, can be community facilities. So these also need to be assessed. For example, village schools do not have windows. Village schools have poor infrastructure. So meaning when if it's a road construction project, you find that the vibration from the road construction equipment can cause cracks on hospitals, on schools, on churches that are very close to the road. There's also pollution, air pollution. The dust from road construction activities can have an impact on the school. So noting all this is really important. So the purpose is to map and evaluate accessibility, enrollment, and school quality near project sites in Uganda. Key factors: infrastructure condition, resource availability, shape, opportunity, resilience, and long-term well-being. So you have to note this. And then, of course, the community centers continue. Community centers, youth clubs, senior centers, and emergency shelters. All these are sensitive receptors. So now we are going to continue with the hazard identification for flora and fauna. It's also important to understand the type of plants in the project area. For example, you may find there are poisonous plants and then thorny plants, which may need to be cleared during project implementation. So knowing this helps health and safety professionals to provide the necessary training, education, and then PPE and other equipment to manage the risk. And then fauna, we have dangerous animals and insects like snakes, bees in the project area. So knowing that this exists helps health and safety professionals to plan and provide education and sensitization, and then relevant PPE to protect their employees while working. Protect them from snake bites and then insect stings. So when you look at identification of poisonous and thorny plants, purpose of survey, catalog hazardous plants to protect residents. So always remember this information, you may not get it directly, but there is a support professional who is an ecologist. So these professions actually get this information and provide to you. So they may use the information and assess it differently. But for you on the side of health and safety, you also assess it differently. So assessment of dangerous animals. The same information, botanists, ecologists, they can provide you this information. So once you identify that the venomous snakes are there, they are aggressive bees, then you'll come up with, you'll do a risk assessment and then come up with mitigation measures to ensure that your employees are not affected by this. And then, of course, conducting awareness. Sometimes the committee may have not known this. So the information you get from your assessment, you can use it as part of the community sensitization program to let them know actually what is out there in their forests, the poisonous plants, the thorny plants, the snakes. Let them know so that they are protected. So community awareness is important. So in conclusion, a robust health and safety baseline establishes a clear starting point for health and safety across projects, combines environment, transport, community behavior, and hazards for clarity, guides interventions that protect people and strengthen local resilience, and then informs responsible project design and targeted risk mitigation in most of the projects implemented in Uganda. So this marks the end of our presentation. If you have any questions, if you're watching this video on Facebook, please put your question on the comment section on Facebook, and if it is on LinkedIn, please put your question on the comment section on LinkedIn, and I should be able to answer. But remember, that's the baseline you will need that will help you properly assess the health and safety risks from infrastructure projects or any project that will be implemented based on the environmental impact assessment. So remember, the information you get in the baseline is used for risk assessment and also now development of environment and social management plan, where all those health and safety management plans comes in. Emergency response plan will be developed from that. Occupational health and safety management plan will be developed from that. Okay. Traffic management plan will be developed from that. So that's why all that information needs to be there for you to make a better decision. Thank you.